So what am I going to talk about? Quality in emergency department, the must know. So
6.9.
where are we starting from? So quality and patient safety go hand in glove. So when we talk about quality, if the patient safety is not there, then there's absolutely no quality. Whatever good work you do, and if you do the wrong procedure on the wrong patient, then there is absolutely no quality. So they are both together. Quality and safety are together. Though we talk quality management, it is all about patient safety and safety management in the hospital. This statistics that I'm presenting is not new to all of you, I'm sure. According to the WHO statistics, it is estimated that 1 in 10 patients in developed countries are harmed while receiving care. If this is the statistics from developed countries, then we should all be knowing, as particularly as practicing physicians, all of you standing in the front to manage patient care at the entry of the hospitals, we should all be knowing that this is in our country far more than probably 3 in 10 or 5 in 10. Just a rough estimate. Now, healthcare, we all know, is very hazardous as well. I always compare it to the bungee jumping. For a patient, it is like climbing on top of a cliff and tying a rope around himself or herself and jumping from the top of the cliff. We get scared when we get into an aircraft when there's a small turbulence, but that is one of the most safest industries. However, healthcare is considered under the hazardous category. I'm sure in the morning when you get up and want to get into your department, this is probably how you want your department to be. Obviously, your administrators will not want empty beds. But what I am talking about is a well organized setup. This is exactly what you want, and you dream of having a very organized setup. And we all know how our emergency departments look. This is how it is, very chaotic, too many people trying to manage multiple patients who are coming in, particularly in very busy emergency departments. It is almost like a war zone. And we really appreciate all of you for standing in the front and managing as soldiers the war front. So, a lot of chaos in the setup, too many people involved, doctors, nurses, technicians, and several other people who are assisting you. So it's all the more chaotic when it is the emergency department. So where are we now as an industry in the country? The practice of medicine was simple earlier. Today it is highly complex but effective. It may not have been very effective when our grandparents and parents were practicing. It may not have been effective then, but it was very simple. People were considered, doctors and nurses were almost considered like next to gods. But today, it is very, very different. It is extremely difficult managing healthcare organizations, highly complex. And when we talk about large healthcare organizations, the complexity is more. Small healthcare organizations, we think are easy to manage, but they are even more complicated. So where is the complexity, whether it is in the large hospitals or small hospitals? It is just not a question that we can answer. Everywhere the complexities are too many, the context is so different that any emergency department or a hospital is probably one of the most difficult things to manage. Now, let me jump to what is quality. With all this background of complex setting, what is quality? Common sense tells us that quality is something which is good. Anything that is good, we say is good quality. Quality actually has developed over a period of time with a lot of definitions. In technical use, we have two meanings. One, a product or a service free of deficiency. Then we say it is good quality. Or the characteristics of a product or service that state that satisfies he wants, what he states, I'm not well. You make him better and send him, it is quality. Now, if you feel that his other needs are not met, probably if you're not communicating properly, he may not ask you for all those. Those are implied needs. If they are not met also, then quality is not there. So it's a combination of stated and implied needs of your patients. If you look at a 360-degree view of quality, there are several stakeholders. and different perspectives. Who are the stakeholders? The patients, the relatives, the payers, who are actually the insurance agencies, your own hospital administration. Each of them view quality in a different angle, and you as clinicians view it in a different angle. So, in one definition, putting everything together is very difficult because quality from the eyes of a patient is different from what your insurer looks at, your administration looks at, and you as healthcare professionals look at. So, therefore, it is extremely difficult to put everything together. However, who are we serving? It is the patients. So, therefore, it is extremely important for us to align quality with the needs of our patients. So, clinical quality is doing the right things for the right patient, the right time, in the right way to achieve the best possible result. But will your patient understand what this is? Very difficult. So, therefore, we have to have a mix of both the patient's perspective and the outcome-based perspective as clinicians, what you would want the patient to go with. So, why emergency department matters to all of us? You are the primary entry point for critically ill and injured patients. Your assessment, rapid assessment, stabilization, and life-saving interventions are very crucial for the better outcomes of the patient. You function 24/7. You influence the hospital's reputation, trust of the patients, and also the community's confidence. You play a very crucial role in disaster management, mass casualty management, and also public health emergencies. You act as a gateway to inpatient admissions, intensive care, surgeries, and specialty services. So, therefore, the quality of care delivered in the emergency department often defines the quality perception of the entire hospital. If your emergency department is not well managed and people have the perception that it is not of good quality, that will directly impact the quality of services of the hospital, which is why it is extremely important. With that, what are the challenges which all of you face and all of us as hospital administrators face? Operational challenges, overcrowding, prolonged waiting times, increasing volume, case complexity, and limited availability of beds in most hospitals. Of course, we are aware of shortages, burnout, fatigue of staff, high workload, and very frequent interruptions. Every patient is so demanding. Patient safety issues like medication errors, wrong identification of patients, delay in critical investigations. You are forever on the phone trying to find out the results from the laboratory to take immediate attention. Infrastructural systems, limited space, limited equipment available, and also surge preparedness. You do not know when a mass casualty happens and when you should be prepared. So these are some of the common challenges and common errors that happen. Of course, I mentioned about all of these. So with all these pressures, how do you really manage the quality of your emergency department? We all started talking about quality when our concept of NABH came into the country. NABH is an accreditation framework. So therefore, there are very specific requirements that are put down. And when you meet those requirements, your accreditation is granted to you. But is that what is quality? Certainly no. NABH is only a starting point. It only provides you the framework, whether it is NABH, JCI, ACHSI, any accreditation is only a framework. Beyond that, getting into the data, understanding how we can improve is what is most crucial for us as hospital professionals, healthcare professionals, clinicians, quality managers, etc. So I want to put across to you two important terms that we use: quality assurance and quality improvement. Now, in quality assurance, the primary goal is to meet standards, ensure that our processes meet established standards. You talk about broad debt policy. You put in a protocol which is nationally accepted. You audit against that to see whether you are following the established standards. That is what is your quality assurance. So typically your accreditation exercises are all predominantly quality assurance exercises. So what is then quality improvement? Quality improvement is enhancing these processes and outcomes over time. Now you realize the door to balloon time in your organization for a stroke patient, door flow to thrombolysis time, or any measure that you take is not within the benchmark or it can be improved, you critically look at it and try and improve upon it. So that is quality improvement. So quality assurance often becomes the first step of quality improvement. Now the approach when it comes to quality assurance is a very proactive approach and a preventive approach, which is going back, trying to see whether we have established things. Whereas quality improvement is a reactive. You have the data. You try to work on that data to improve and improvise your processes. And with quality assurance, it is more on defect prevention. I don't want problems to happen. This is the protocol that is put down. I want compliance on a particular process. Medical legal cases, to identification mark, this is how it is recorded. This is what is done. The certificate is sent. So that is process compliance and defect prevention. Whereas quality improvement is typically looking at all your data very crucially, identifying opportunities for improving and constantly improving upon it. What is the nature of a quality assurance? Maintaining a static position. I'm happy, I'm meeting the requirements, consistently meeting the requirements, I'm okay. Whereas quality improvement is dynamic and fostering change. So what are the tools that are used? Typically, audits, inspections, documentation, all falls under quality assurance. Coming to quality improvement, it is about data, quality analysis of the data, your clinical audits, your feedback loops, closing them, the trials that you take, the projects that you undertake, that is what comes under quality improvement. I hope you have understood the two broad things that you will have to invest in. So don't limit yourself to what your accreditation bodies are talking about. That is only quality assurance. You have to go beyond that and look into quality improvement. Now, in any good quality management system, the QA and QI must work together. So only then you have a very powerful framework for a quality management system. So QA, which is your quality assurance, establishes only the foundation. It is only the starting point. It is the foundation to look at your compliance to the requirements. Now, this QI, it builds on what you put together as a QA. It builds upon the QA. By analyzing the data that you have obtained from QA, the QI identifies areas where existing processes can be refined, made better to provide better outcomes. And between the two, there is always a feedback. If you don't work on that feedback loop and continuously close, then it is of no value. It is only a QA. So the feedback loop becomes the most important point. So when you talk about quality management in ED, forget about your accreditation requirements. That's only a quality assurance. Now, how do you really work around the domains of quality management? With using your accreditation framework, the QA as a framework, how do you go beyond? And what are the various aspects that you need to look at? We call it the STEEP, which is STEEEP. Safety, timeliness, effectiveness, efficiency, equity, and patient-centeredness. So I'll quickly touch upon this. Safety, we all know, avoiding harm to patients. Use of technology is very crucial. Devices like smart pumps, clinical decision support system, robust EHR, document management system, so that you don't miss out on documentation, your incident management system, all these can really help you, one, avoid, and if they happen, how do you actually work on them? Timeliness is crucial in an ED, reducing waits and harmful delays, automating your manual tasks, patient tracking system, where are they? Are they in the radiology department? Where are they currently? How do you track them? The workforce tracking, they must have shifted a patient. When are they coming back? Where are they? And automated workflow software. And most important today, all of us talk about the point of care testing, which also gives you very good outcomes when it comes to timeliness. Effectiveness. There are several technology tools available for decision support system so that you avoid overuse and also underuse. We keep ordering investigations as in, just like tick lists, I must say. So the effectiveness is very crucial. Efficient, again, avoiding waste, including waste of equipment, supplies, ideas, and energy. Your inventory management can help you in a big way, reducing waste when it comes to your supplies, even papers, everything, and sensors and other things can help you really reduce waste in your setup. Equitable. How do you really monitor these patients from the time they are picked up from their home to reaching you, or remotely monitoring these patients, either using remote monitoring or wearables or the communication system that you have established that will provide the equitable care even if they are very far away in the community. How do you really take care of them with the best possible standard treatment guidelines? And the most important one is patient-centered care and providing respectful, responsive care to the needs and preferences of your patients. Today we talk about personal health records, all your apps, mobile apps, everything, including the patient portals, and also not just understanding the patient satisfaction, but getting into their experience measures. When you received them, was the experience okay? What were the different points at which you could improve? Patient reported outcome measures after they get treated, move out for a specific condition. Can you follow up with them and find out whether the outcomes were good? So these are things that will really help you understand both the experience, their satisfaction, and also the outcome of the care that you have provided. And I would strongly encourage every emergency department to set up a patient advisory council. Listen to the voice of the patients. You call them, have them, and understand from them their experience and what you can do better. So that's something that you can do in patient-centered care. So to talk about the QA and QI framework, you do a lot of key performance indicator monitoring. There are several benchmarks that you have put together. If you apply this to everything that I talked about, safety, timeliness, efficiency, effectiveness, patient-centeredness, put them all together, understand the data, and if you are away from the benchmark, work on them as a quality improvement project using the PDSA cycle. You plan, you do, you study, you act, improve the feedback loop, and keep on improving on it. Only then you can have a good quality management framework and not limiting yourself only to the accreditation exercise. So you as leaders, you have a big responsibility. You have to train your staff, provide your staff with the resources, engage with all your staff, lead by example. So if you are not in the front to lead this exercise, nobody will follow. Hold everybody accountable. Establish trust between you and the employees and the management. Always have an open door policy and take incidents very seriously, do corrective preventive actions and communicate the actions to everybody in the organization so that it doesn't repeat. So I want to end by saying we really need to start somewhere. And when do we start? We can do wonders if we have love. And that I'm sure all of you have in plenty, whether it is the love for your patient, the love for your profession, or the love for your God. So it is for all of us to look back, turn back, go backwards to monitor and improve the systems. And only then quality management is established in your emergency department. So I always say, do not do it for the sake of NABH, JCI, ACHSI, QAI. That is needed. But beyond that, with the love that you have for your profession, if you work backwards and monitor and improve your system, then you have a very good quality management system, and I'm sure your patients will be very, very happy. Thank you so much for this opportunity, and I'm happy to answer any questions.